So hi everyone, my name is Stephanie Giesigan and today I'm going to be presenting the epidemiology and control of HIV in New York City. Overview of this presentation is going to be, we're going to be talking about the background of New York City, the HIV outbreak, surveillance, the barriers that they have encountered, previous prevention plans, my personal statement, and a prevention plan campaign that I have prepared to add to the prevention plan. So New York City is situated at the southernmost point of New York State and one of the biggest natural ports. With 5 different boroughs: State Island, Bronx, Brooklyn, Manhattan, and Queens. As of July 2023, data indicates that New York City population was 8,258,000, when the city's population density was 27,744 inhabitants per square mile, which means this is the busiest and American metropolis in the United States. As of 2022, the city median age was 37.5, and 36.3% of the city's population is foreign-born, with 40% of the children coming from immigrant mothers. The poverty rate was 17.2, and 70% of the New York household rent their homes. And the household income was 76,000. And at the right, we see the chart of the New York's demographic, which white represent 31.2%, Black or African American 21%, Asian was 14.4%, and Hispanic being 14.2%, and Hispanic white was 6.3%. The fight against HIV is progressing significantly in New York City. In 2020, 396 people in New York received a new diagnosis, and it decreased 21% from 2019 and 76% from 2001. Another significant achievement in the city's protracted battle against HIV pandemic is to drop a new diagnosis. Between 2019 and 2020, there was a decrease in new HIV diagnosis across all transmission categories, including all age groups 13 and older. Between 2016 and 2020, the estimated number of incidents decreased by 29%, with heterosexual women and men who have sex with men seeing very sharp drop from 62% to 48%. However, inequalities persist in many areas, as in 2020, 92% of newly diagnosed cisgender and transgender women and 79% of incidents on cisgender and transgender males were Black or Latino. Isolated cases of AIDS were reported around 1970s. However, recent studies indicate that the present epidemic may have begun around the mid-1970s with 100,000 to 3,000 people already tested positive with HIV. More than any other American city, New York was impacted by the AIDS pandemic in 1980s, and as stated in a 2015 interview with Dr. Michael Simberg, which is chief of the Department of Veterans Affairs in New York Harbor Medical Center, he discussed the first outbreak was known as the gay-related immunodeficiency disease, in which doctors didn't know how to treat the disease, and so they just decided to sit around and discuss about the possibilities of prevention. And then they saw that the disease was not only in homosexual men, but also on people that were drug users were also getting infected. One of the most famous cases was a school teacher who had Kaposi and pneumonia, and was one of the first U.S. citizens to die and he was a New Yorker. So according to the 2022 New York surveillance system, the data is derived from the HIV-related laboratory test ordered by the NYC-based providers and the surveillance investigation directed by the NYC Department of Mental Health. The HIV surveillance reported as of December 31st, 2022, as you see in the right, that 1,624 were new diagnosed of HIV, in which 43% were African American, 40% were Hispanics, 66 were between 20 and 39 years of age, and 16 were 50 years and older. At the moment that they were diagnosed, 41% of them were severe poverty, and the causes of death were regarding HIV was of 1,603 deaths, and HIV incidence was consistent between the year 2020 and 2021. So following up on the newly diagnosed of 1,624, of those 62% were identified as men who had sex with men. Heterosexual was at 49%, and less than 1% of the population identifies as transgender males, 3% as transgender women, and 79% as men. Of all of them, 79% of all the people living with HIV in New York City were virally suppressed by 2021. Some of the limitations that New York City encountered in HIV control and epidemiology were healthcare, social barriers, stigma, mental health issues, and social demographics. For healthcare, most of them highlighted the complexity of medical insurance and biobank programs and other services. They also mentioned that it was difficult to access all the websites, and most of them were health literacy, so they did not understand what they were saying. The language barrier that they had, also the lack of HIV primary care physicians, and the availability was not recent. They had to wait a month or two for an appointment and newly diagnosed. On social barriers, there was a problem with social stigma and self-stigma. They also thought that fear of revelation, social isolation, to seek medical care, so they preferred just not to say they had something or go to a medical facility because they were going to be judged under sexual orientation or substance use, or if they were a sex worker or transgender identity. Also, if they were they didn't have an immigration status. Another problem was mental health issues, that the majority of people that are at risk of HIV probably have depression, anxiety, or use illegal drugs. And finally, a problem with social with, let's say, like cultural ethnicity. So as we see at the right, we see that the majority of the incidence of HIV is around the darkest purple, which is a very high poverty. And that's one of the reasons or barriers or limitations that we see in HIV prevalence. So in previous prevention plans in New York City, the HIV/AIDS Service Administration was a resounding success, providing comprehensive service to people living with HIV. This was followed by the HIV Prevention and Health Planning Group from 2000 to 2010, which effectively coordinated the efforts of testing events and making more services provided for HIV diagnosis. In 2015, the New York City launched the Ending of the Epidemic Plan, which is the aim was decreasing the number of new HIV infections and enhancing the health and well-being of individuals in New York City with HIV. This plan was based on the New York State Blueprint of Ending the Epidemic, and it had many strategies, In 2019, the U.S. Department of Health and Human Services revealed the ending of the HIV epidemic, a plan for America. The plan intended to cut down new HIV cases by 75% in 2025 and by 90% by 2030. Ending the HIV pandemic had four pillars, which are diagnose, treat, prevent, and respond. And that's as New York City, New York State, New York City and Long Island collaborate to create a single generating HIV prevention plan, and that's from 2017 to 2021. So after reading the current previous plan from New York City, a key point is missing in the plan. For instance, adhesion to medication is not covered. This is a serious problem that can increase resistance to medication and consequently increase the viral load. They should be focusing on barriers and limitations, those who are not adherent to the medication, barriers such as substance abuse, illegal drug abuse, lack of education on drug side effects, drug interaction, and prolonged use of the antiviral medications. Some members of the HIV population are worried and concerned that using the medication, the ARTs, for a long period of time can have serious consequences. So this, interferes with the adhesion of the medications because they decide just not to take it, or maybe just take it once a week, or maybe just decide to not take it for over a month. An important thing is that there's a new medication called Cabenuva, which is an injection, and it's provided every 3 months by a health provider. So they don't need to take a pill. This could increase adhesions to medications. After reading the current previous plan in New York City, I did not see any campaigns in public places and venues such as bars, nightclubs, casinos, public events, festivals, and diverse locations that condoms, lubricants, and other preventive measures are offered. Although New York City had a free initiative, free condoms offered everywhere in 2006, it only mentioned that 40% of these venues were targeted. Furthermore, according to what we see in the incidence of HIV, it highlights that 797 of men that have sex with men are the highest that are diagnosed with HIV, and heterosexuals of 293. So they have unprotected sex. For that, therefore, I am proposing a campaign in this venue, such as delivering or putting vending machines to have condoms and lubricants that help protect against unsafe sex. The campaign is going to be, it's called You Are at Risk, and this is going to be target all these venues where the general population meet people and friends. So as you see in the right, this is going to be the logo and the picture that we're going to put in all these venues. We need to create awareness and to educate the population that HIV, it's not only for the underserved and marginal population, but it can affect everyone, and that's why we are trying to protect everyone at these places. So this is the campaign that I am proposing to add to the prevention plan that it's actually in place in New York City. I wanted to thank you for listening to my presentation. And these are my current reference that I use for this presentation and for the paper assigned in the course.